Welcome to this introduction to the metric system. The metric system is a decimal-based system that's used globally in healthcare. And so understanding it as a nurse, as a healthcare provider, is really important in being able to do accurate dosage calculations, which is the focus of today's video. So I will be reviewing some major components of the metric system, and then we'll dive right into calculations and how you can convert from different units of measure within the metric system. So first things first, you probably want to know about mass when it comes to the metric system. Mass or weight is measured in grams, kilograms, micrograms, milligrams. And I'm going to teach you how these relate to each other. So first things, you may have heard of someone getting weighed in kilograms. Kilograms are the largest unit of measure that we typically use for mass in healthcare. And so someone's adult weight is often measured in kilograms. Then we go on to grams, and there's a difference of 1,000 units of measure between kilograms to grams. So if you were moving, let's just say you measured something as 2,000 grams. If you wanted to figure out what that was in kilograms, you could just divide by 1,000, and that would get you how many kilograms there were. So 2,000 grams is 2 kilograms. So you can easily move back and forth between these units of measure by multiplying or dividing by 1,000, which is part of what makes the metric system so easy and great to work with in healthcare. The next part of the mass part of the metric system I want to go over is milligrams. Milligrams are often used for dosages. So going from grams to milligrams is also 1,000. And I'll show you the demonstration of how to do these conversions. But if you take 1,000 milligrams and divide it by 1,000, you're going to figure out how many grams you'll get. The opposite is true. If you want to go from grams to milligrams, you multiply by 1,000. So you can see here this kind of continuous effect that's happening as we get to smaller units of measure or as we go up in units of measure. The final is micrograms, at least that you'll need to typically know for healthcare. And 1,000 micrograms equals 1 milligram. So you can see the connection there. Again, if you're going from milligrams to micrograms, you just multiply by 1,000. And if you're going from micrograms to milligrams, you just divide by 1,000. Now, there are other ways to do these conversions, but this is one simple way you can memorize the process to move from different units of measure. Now, one thing I like to highlight as you get into your dosage calculations is that when we're switching how we describe someone's weight, we are not actually switching how much they weigh. For example, if I have a 2 kilogram weight, let's just say I'm lifting some weights here, 2 kilograms, okay? A 2 kilogram weight, I could also describe that as it's the same thing as 2,000 grams. So if we lifted this weight, we could say I'm lifting 2,000 grams or I'm lifting 2 kilograms. That's the same weight. It would feel the same in our hand, but we would be describing it in two different ways. And so this is where we can use what we know about the differences between a kilogram and a gram, or a microgram and a milligram, or a milligram and a gram. We can use that information to convert from different units of measure. And this is very, very helpful in your dose calculations. Now let's move on to talking about volume. Volume is another part of the metric system that's really important to understand because a lot of our medications come in liquid forms. They're not always based on the weight. Sometimes we have the weight of the dose in our calculations, but we also have the volume of like an IV bag or of a syringe that we fill up with fluid, or even a medicine cup that we put some fluid in. And that fluid is, again, medication typically. So we use liters to represent the largest unit of measure typically in healthcare when we're talking about fluid. Like a liter bag of saline, normal saline, could be given to your patient over the course of a shift. We also use milliliters. Now there is that 1,000 difference, 1,000 milliliters equaling 1 liter between milliliters and liters. So if you wanted to go from liters to milliliters, you would again do that multiply by 1,000. If you wanted to go from milliliters to liters, you would divide by 1,000. And you could go into like centiliters and deciliters and different types of liters, but in healthcare, we don't typically use those measurements. We typically just refer to our volumes as liters or milliliters. Now, we could also go into other parts of the metric system like length or temperature, but those aren't necessary for dosage calculations, and that's the focus of this video. So we're just going to move on to practicing converting from different units of measure. Now, in this video course, I'm going to introduce dimensional analysis or the unit factor method, or you can just think of it as a way of converting from different units of measure to other units of measure. This is a very cool method to use because it can be translated to all of your dosage calculation skills. Some students think they want to memorize a formula, and I do have a video course I will be coming out using formula methods, but dimensional analysis or the unit factor method is kind of usually the foundation behind those formulas. And I don't know if you're like me, but memorizing things, I can do it, but I often forget if I don't use it. Whereas if I can understand the concept and how something works, I'm much more able to recall it. I'm much more able to use it accurately. And so unit factor method is so helpful for students. I've seen this in my classrooms. If those that push through and learn how to do this method can be really flexible with their skills and really accurate consistently throughout just not their nursing school or healthcare school of any sort, but consistently throughout their profession too. So as we get started with this dimensional analysis method to convert from units of measure, let's start with our first question here. We are supposed to convert 500 grams to milligrams, okay? Now, if you remember, I'm going to write the conversion factor, and the conversion factor is just like how many things equal how many other things. All right, it's supposed to be equal to 1. So we know that 1 gram is equal to 1,000 milligrams. Now, this part of things you will have to memorize. All right, 1,000 milligrams equals 1 gram. 1 gram equals 1,000 milligrams. Another way that you can write conversion factors is kind of like a fraction. It just has the top and the bottom have to equal 1. So we know 1 gram equals 1,000 milligrams, or we could write 1,000 milligrams equals 1 gram, and they're top and bottom like that. So we know if we simplified this, it's still equal to 1. So those are really helpful conversion factors for us. We can use this information when we convert our problem 500 grams to milligrams. So when you're starting with a question, always start with what's given to you or what's ordered, or in this case, it's just our given amount. So if we just say I had to give a patient 500 grams of a medication and we needed to convert that to milligrams, we would need to start with the 500 grams. So we start with 500 grams, and then we can multiply by a version of 1 to do our conversion factor, and then convert to a different unit of measure. A lot of students ask me, well, which one do I put on the top or the bottom? Which one do I choose? Do I choose this this conversion factor or this conversion factor? I mean, they're the same conversion factor. They're both equal to 1. If you remember back to some previous math education, hopefully you learned that if you put something on the bottom of a fraction, it can actually cancel out on the top or the numerator part of that fraction. So we always want to put with our conversion factors what's ordered here and starting with on the top, on the bottom over here, so that those units of measure will cancel out. Then we can simply take our top here, I forgot to fill that in, 1,000 milligrams equals 1 gram, and we put that on the top. So here we have what we're starting with, or I'm going to call this our order, and then we're going to move on here, and this is our unit conversion. Unit conversion, okay? Just to label kind of what we're doing there. If you remember just how to do basic math here, you can use a calculator typically in most or dosage calculation courses. So you're going to take 500 grams, but now the gram, that's canceled. So you just take the 500 with the number there times the 1,000, all right? And you're going to get 500,000, and I would label it with milligrams. See, milligrams was the only thing left of the units of measure that didn't cancel. So 500 milligrams is your final answer for that question. That's a lot of milligrams. This would be a huge dose, but for sake of illustration, I hope this is helping. Now let's move on to converting liters or milliliters actually to liters. This is a volume question, okay? So let's just say that we have 3 1,000 milliliters. I highly recommend you label everything so that when it comes to doing the actual conversion factor, you remember which one goes on the bottom and which one goes on the top. Now we know our conversion factors, the top has to equal the bottom has to equal the top. So we know that 1,000 milliliters is equal to 1 liter. And we're going from milliliters to liters. So we know milliliters cancels here, and then we can do our math. So 3,000 times 1 is 3,000. Then 3,000 divided by 1,000 is 3. And so our final answer is 3 liters for this question. I hope this is starting to make a little bit of sense. We'll keep moving on, and then you can continue on to do practice questions, and it helps solidify this information. I do recommend writing the labels because I think it helps a lot of students eliminate silly mistakes where they accidentally flip the conversion factor. Because you can see if you flipped this, that would completely throw off the question. You would end up with 300,000 liters, which is absolutely wrong. So don't flip those. All right, moving on to the next question. We have 2,500 milligrams, all right, and we want to go to grams. So we're going to multiply our conversion factor here. We know that, let's see, I'll put milligrams there, I'll put grams on the top. I know that 1 gram is equal to 1,000 milligrams. And then we can do 2,500 times 1, and then divide by 1,000. You want to make sure you multiply across the top, and then we only have one number in the bottom here, so we then can divide by that. All right, so we have here 2.5 grams. Again, you'll want to always label your answers, because 2.5 what? 2.5 tablets, 2.5 grams, 2.5 liters. Labeling is very important in dosage calculations. All right, moving on to our fourth question. We have 0.5 liters, and we are trying to switch that to milliliters. Again, bring out your conversion factor. We have 1,000. Oh, I messed up. We have a liter on the bottom here. So 1 liter is equal to 1,000 milliliters. And then the liters would cancel liters. And here we go. 0.5 times 1,000 divided by 1, and we got 500 milliliters is equal to 0.5 liters. Now, you might be looking back at some of the previous slides and seeing how you could memorize, divide or multiply by 1,000. And that is perfectly appropriate. If you want to memorize that and use that, that's fine. But I think learning the dimensional analysis can help you in future calculations, and it also helps you if you ever forget which way, do I multiply or divide? Because sometimes on a test you can get turned around, and writing it out this way can help you make sure you know exactly that you're doing it correct. So let's start with the final question. We have 7,500 micrograms now, those micrograms, and we're going from micrograms to milligrams. So I know that 1,000 micrograms equals 1 milligram. Again, you'd have to memorize those conversion factors, but it's nice that they're each 1,000. So the micrograms are smaller than the milligrams in how they measure. So 1,000 micrograms equals 1 milligram. We can cancel our units here. 7,500 times 1, and then divide that by 1,000. So essentially we're dividing 7,500 divided by 1,000, and we are getting 7.5 milligrams for our final answer. I hope you found this video on the metric system helpful. We will translate these skills of dimensional analysis and unit conversions into a lot of other calculations. So make sure you practice, and when you're ready, move on to the next set of skills.